Don't take everything that people bring by. I have very many well-meaning people who are bringing remedies by. Oh, Jack, you've got it. You absolutely have to take this. It's 3 times a day, 2 teaspoons a day. It's going to cure you. Really, you know, and who's recommending it? Oh, well, it was recommended from a friend who's connected to the medical system in India. Oh, really? And there was a guy 10 years ago who did this, and he was completely cured. A guy. Okay, really? Do you have his name? Well, no, I heard about it through this friend. Oh. Is there any medical certification for any of this? You know, the doctors don't really know what they're talking about, Jack. You want to be taking this. I insist that you try it. It's going to cure you. I can't tell you how many of these, and sometimes they come and they leave them on our front doorstep. I make a habit of checking everything with my medical team, and just to make sure. And they encourage the alternative therapy. So when my mother-in-law, who lives with us, feeds me these amazing Chinese soups from 10,000 years of Chinese woman's wisdom being passed down, I eat them. I wouldn't survive in the household if I didn't, but there's no question that's helping, and the ginsengs and the various basic ones that we all know about, we certainly turn to those. And maybe it just gives you a little, you know, mental boost as well.
I looked at one place in the States. I thought, oh boy, I'll be able to take my RV down there and I'll just stay there for 2 weeks. They're going to cure my cancer and I'll come back. You know, I honestly had lulled myself into some kind of delusion that I could get this thing dealt with more easily in the United States in some town that I'd never heard of. And it took my wife and several doctors and friends to bring me down to earth and say, Tim, we have the tools, we can do the job, just let us do it right here in Ontario.
Early detection can prevent some of those more grim diagnoses, although it still means you're going to go through some treatments that can be difficult.
I knew my father had it, and he told me his father died of it in his 50s. My father was diagnosed in 1992, and supposedly this is 1 year after the PSA test came online in Quebec. So had the PSA test not come online, he wouldn't have known, even though his father had it before him. I don't believe he was checking for it. So listen, the fact that he had it, and his father had it, I knew I was in line, and I started PSA testing and having digital rectal exams from the age of 35, which to conventional wisdom is 15 years too soon, but hindsight being 2020, it worked out well for me. And my brother, who is 3 years my junior, he's been testing since.
Have a positive attitude about what the outcome is going to be and what the future is going to hold, and make sure you rally your family around you. Make sure you rally whatever support you can, whether it's family, friends, strangers, it doesn't really matter. There's a world of support out there. Some of the people you talk to who've had prostate cancer will have had good outcomes, some will have had poor outcomes. It doesn't matter. The majority will have positive outcomes, and that's just going to help to help you preserve your sanity and stay focused on the positive outcome you're going to have.
Keep as much of a positive outlook on it as you can, and just say to yourself, I can beat this. Whether you can or not doesn't really matter. It's the fact that you're going to try.
But they should realize that it's not something that they alone are dealing with. There's an awful lot of men out there that have dealt with it before them. There's a lot of good information out there.
Prostate cancer is not a death sentence unless you don't act upon the options given to you. Faith and fear can't live in the same heart at the same time. So you have to decide in that moment whether you're going to have faith that you're going to come through this and survive, or whether you're going to have fear and you're going to let it overwhelm you and take over your life and ruin yourself and your family. So faith is belief in action. So I took action by going to the support groups, by educating myself with the doctors, by talking to naturopathic doctors as well. I got as much information as I could, and then I looked for the best of the best in their field.
I broke my back in a car accident when I was a young man, and they told me then I'd never walk again. And I've faced adversity, and I think that sort of I learned some lessons from that I brought with me towards this situation that I find myself in with prostate cancer. And that's my way of dealing with it, is not to ring the alarm bell. You know, it's to inform the people that should be informed, and not really too many more people. You know, I didn't want to broadcast it.
View it as a challenge, not a problem. And keep an open mind, keep a positive outlook, regardless of how dire the outlook may seem to be or may be presented to them. There's always hope. The last thing you want to remove from anyone is hope.
Yes, I was diagnosed, or perhaps you're going to be diagnosed with prostate cancer, but there is hope. And that hope can come through medical treatment, through supportive friends, through a faith community, through support, through prostate cancer support groups. That, I think, is what men need to know. The fact is that they're not alone, and that there is hope out there.
Of staying on top of it, making the you in charge of the cancer as opposed to the cancer in charge of you. You don't cease to exist as an individual when you have a diagnosis of cancer. The cancer can't redefine you. You have to put it aside and make it something that you can beat, or that you can overcome or control, and that it's not going to redefine your whole life.
I think a support network is absolutely vital, that you can't do this on your own. So don't even try. And give up your precious male pride and ask for help, and you will receive it.
Time. Actually, I've more than doubled the amount of time I've been here. And I'm going to continue to fight even though my cancer is back, which is why I'm keeping on top of it right now, to see what we can do. But I'm not going to go necessarily the same routes that I went before. So once again, I'm now going to try and find some more information on new things that I can do to challenge and fight back.
The hospitals and doctors are there to do the surgery, do the treatments, do the hormones, but I think society and families are the ones that do the healing.
Making sure you set yourself goals every day for what you're going to achieve after you have your surgery. For example, one of my goals is when I came out of hospital to come in the house here and to walk up the steps, and we have about 20 steps from the first floor to the second floor. And not just to walk up the steps, to do it on my own without even holding on to the rail. And that's what I did. And then the next day I kind of walked up and down once, and then the day after that twice, and the day after that 3 times, plus walk around upstairs and so on. Setting goals like that for yourself, or targets to achieve every day.
There was a prostate cancer support group that met once a month and recommended that told me when the next meeting was, and recommended that I come, and I absolutely, I got so much comfort, even from that initial drop in at the Wellspring Center. But when I got in and was, to the first prostate meeting, it was like, wow, I'm not alone. This is good, And there's guys that were, most of the guys there had progressed further along the path. They'd had their treatments and were, most of them were having nice recoveries. Some of them had been treated years ago and were having good health ever since. So it's a wonderful buoying effect on my spirits. And so I thought, you know what, I can do this.
And so having a few friends that are very close to you on the journey, in the technical sense, Olivia's with me at every single appointment. And I recommend that if somebody's watching this video who doesn't have prostate cancer but believes that it could be a possibility in the family or is a possibility, it's so helpful to the patient to have somebody there who's thinking about the questions and helping digest and helping with the research. And use the tools that are available. Use your friends. Don't be afraid to ask. They're probably wishing you had asked.